The All India Institute of Medical Sciences is one of the most prestigious medical colleges and medical research public universities in the country. It is one of India's busiest medical facilities, with over 8,000 to 10,000 patients passing through its doors daily. It's easy to understand why so many people come to AIIMS. It enjoys a high reputation and has set high benchmarks in patient diagnosis, care and outcome. But how is a medical facility that sees so many patients daily able to provide high quality care to so many patients? This is where a clinical decision support system plays a crucial role, enabling clinicians make the right decisions. And AIIMS has had long-standing partnership with UpToDate in their hospital's clinical workflow, helping clinicians make evidence-based decisions at the point of care. AIIMS Librarian Dr.S. Siva Chidambaram is charged with the responsibility of enhancing knowledge of doctors and students. He knows better than most how important it is for doctors to have the best available decision support. How does your teaching hospital benefit from having UpToDate?
UpToDate is a point-of-care database. It is different from other biomedical research databases, just like abstracting indexing service, PubMed or any other database. And it is made by the doctors, for the doctors and by the doctors. And these databases are used heavily by the doctors while they are taking patient care for their important clinical information, and they also know about the drug interaction and other things from the UpToDate database.
How does UpToDate help you?
UpToDate is an instant reference tool for any biomedical research people. Say for example, acute encephalitis syndrome that was recently happened as an epidemic at Bihar incidents. So whatever the information you need for this syndrome, you can get all the details in a single page, and it leads to the further whatever the research papers are there a particular area. So then people can go easily and they can do the research in more.
What are the advantages of using UpToDate compared to other clinical decision sources?
UpToDate has most of the systematic review articles, and it has a very specific reference derived from the very specialist of particular doctors group, and it is highly recommended reference sources used for their research.
What is the best thing you like about UpToDate?
The UpToDate is really up to date in the information, and second is that UpToDate is a tool for anybody, like those who doesn't know even information literature or computer literature, they can easily use any place, anytime, anywhere.
Would you recommend UpToDate to others?
Yes, definitely. Separate hospital or any other research organization related to the biomedical field, I could recommend the UpToDate, because it is purely systematic reviewed and the contents are updated by the doctors. So this will be a very good reference tool for them to lead the research.
UpToDate is the first point of reference for doctors, nurses and students in their search for evidence-based answers to their clinical questions. UpToDate has been established as the world leader in evidence-based clinical decision support solutions that helps medical professionals search any clinical term or condition and determine the best treatment for their patients. As the only clinical decision support resource associated with improved patient outcomes, it's only fitting that one of the best medical institutions in the country empowers their doctors and students with the UpToDate advantage.